Today we will start the Unit 4 Nutritional Problem Part 2. Then vitamin deficiencies were there. One is vitamin B1, thiamine. Then clinical deficiency is beriberi, riboflavin, vitamin B2, araboflavinosis, niacin, vitamin B3, pellagra, then B12 and folic acid, megaloblastic and pernicious anemia. Then vitamin C by ascorbic deficiency, then scurvy, clinical deficiency is scurvy, and D is rickets and osteomalacia. First we will study beriberi. Beriberi, which is caused by the deficiency of vitamin B1 or thiamine. Vitamin B1 is known as thiamine. Once a major disease problem in many parts of the developing world, then Bontius 1642 and Nicholas Stahl 1652 was the Dutch physician who gave the first clinical description of beriberi. Symptoms are very are of two types are there. One is cardiac beriberi or wet beriberi, and second one is dry beriberi and infantile beriberi also there. Three types of beriberi are there. One is wet beriberi, dry beriberi, infantile beriberi. The severity of the deficiency depends upon the degree and duration of this deficiency. The early clinical features are anorexia and dyspepsia associated with heaviness and weakness of the legs. Then its clinical symptoms are are anorexia or loss of appetite. The patient is unable to eat food, or not asked to eat food. Then associated with heaviness and weakness of the legs, or legs weakness are also there, or weakness in both lower limbs. There is tenderness of the calf muscles on pressure, with complaints of pins and needles pain and numbness in the pain. And the pains were related to such like say needles pricking, needles when we will prick needles in our legs or in our muscles. These types of pains occurs in beriberi. The knee jogs are usually sluggish and occasionally slightly excurted. Then cardiac beriberi is the wet type, and sign symptoms are of ventricular failure characterized by difficulty in breathing, particularly in physical exertions, palpitations and edema. In case of dry beriberi, lots of lower limbs pains are there and loss of appetite. In wet beriberi, cardiac beriberi, shortness of breath, palpitations, edema also seen, etc. Edema is the important feature of wet beriberi. Wet beriberi, the main symptom is edema or swelling in the body parts. It may develop rapidly and involve not only the legs but also the face, trunks, and serious cavities. Um, Edema is not only seen in pedal or legs enema or pedal enema. It also seems in face and hands also. Dry beriberi is milder form of disease with polyneuropathy with clinical sign characterized. Dry beriberi is a neurological disorder. It needle pain like pains are there, associated pains are there, tenderness of muscles, muscle cramps there, weakness in limbs are there. Infantile beriberi is seen in breastfeed infants. Then third one is infantile beriberi means breastfeeding infants are affected in this infantile beriberi due to low thiamine in mother's milk, due to the low quality or low quantity of thiamine in mother's milk. So the infant is suffered from infantile beriberi. Two types of infantile beriberis are known. These are cardiovascular type, neurotic types are there. In infantile beriberi are also two types. One is cardiovascular or wet type beriberi, and another one is dry beriberi, neurotic type. Cardiovascular wet types are between the ages of 2 to 4 months. In infantile beriberi, the wet type beriberi, the babies between the ages of 2 to 4 months. The onset is acute and clinical signs symptoms. Cardiac failure is also there. Then rapid heartbeat, but tachycardia is there. Dyspnea, difficulty in breathing, enlargement of heart, etc. are seen in cardiovascular or wet type beriberi in infants. Then neurotic dry type beriberi, it the symptoms of peripheral neuropathy, tenderness of calf muscles, tendon jogs, hyperesthesia in they are in children, but pseudomeningeal form, cerebral symptoms are there and it occurs between 8 to 10 months of age. Dry beriberi is seen in 8 to 10 months of age, and neurological disorders are seen in infantile body. Causes are, what are the causes? Due to the lack of thiamine in the food, mother's food or person's food. Consumption of foods of higher energy with low thiamine content lead to lower vitamin energy ratio. The persons who are taking low thiamine rich food, they were suffering from thiamine, very very. Then the risk group include children, adolescent, athletes, elderly persons. All groups of people are associated with this disease. Treatment. What are the treatment? The beriberi is the administration of thiamine. Parent, parenteral administration of thiamine doses of 10 to 20 mg twice or twice a day gives dramatic result. If we will give 10 to 20 mg of thiamine twice or thrice per day, then results in very good results will see. Care is required as it can lead to hypersensitivity reactions. Oral administration of 5 to 10 mg of thiamine for longer duration is preferred. If it's seen any other swellings, edemas, hypertension, etc., then we should reduce the amount to 5 to 10 mg of thiamine for longer duration is preferred. If we will take longer duration, then we will reduce the doses of the thiamine. Then preventions. In the community, there are several possible approaches to the prevention of beriberi. Avoiding excess milling and consequent high polishing of rice. We will aware the people not to take high polishing rice. Then proper cooking practices such as not using and throwing the excess water for cooking of rice with help in retention of thiamine. We should not we should not throw the rice soaked water or rice gruel water, because the thiamine would discard from the rice. Parboiled and hand pounded rice are good sources of vitamin A. Parboiled rice and hand pounded rice, those who have red color of coated on the rice, then it is good sources of thiamine. And please use red brown rice instead of polished rice. hand pounded is the parboiled rice are good. उषुना भातटा बहुत भल तार चोपाटा जो थायमिन थाए तो जिते पॉलिश हम से थायमिन लॉस हम. Then educate to consume food highly which are rich in thiamine such as whole grain cereals, raw, hand pounded, parboiled rice, pulses, wheat germs, etc. Whole pulses, whole cereals, we should use this type of whole pulses, then we will get more thiamine. We should be encouraged to avoid excessive consumption of alcohol. If we will take excessive consumption of alcohol or alcoholic rich food, such as carbonated drinks, caffeinated drinks, alcohol, etc., then thiamine will not absorb in our body. After thiamine, and then riboflavin deficiency and vitamin B deficiency. Riboflavinaceous are seen. Riboflavin is one of the vitamin B complex vitamin, deficiency of which are encountered in communities frequently. Surveys carried on the different. Riboflavin is the cofactor number of the respiratory enzymes in flavin mononucleotides which are involved in energy metabolism. Two types of riboflavins are there. One is uh, FAD, but flavin adenine dinucleotide, and another one is flavin mononucleotide. Then two types of riboflavins are there which is involved in energy metabolism. It is used in It is necessary in energy metabolism. Then thus it plays a major role in intermediary metabolism. The dietary deficiency of this vitamin condition called ariboflavinosis, characterized by mouth lesions. What are the symptoms? Lesions in mouth and tongue, skin, corneal, hematological changes. Due to the deficiency of vitamin B2 or riboflavin, then we have some mouth sores are there, tongue sores are there, then corneal also hematological changes, skin problems are arises, deficiency of riboflavin. The commonest signs are angular stomatitis, crack in the angles of the this side of the mouth, then glossitis, sore of tongue, then chelosis, ulcer on lips. Three types of diseases are very much seen in this riboflavin deficiency. One is angular stomatitis, glossitis, and chelosis. Then angle of the mouth, small fungal infection may supervene. In glossitis, tongue is actually inflamed and papular projection, tongue become these kinds of three types of these types of yes, these types of diseases are seen in due to the deficiency of riboflavin. Then what are the symptoms are angular stomatitis, glossitis, chelosis, nasolabial dysplasia. Then causes dietary inadequacy is if you will inadequate amount of riboflavin, if you will take very low amount of riboflavin in our diet, then this riboflavin deficiency occurs. Inadequate consumption of pulses, nuts, milk products which are household belonging to low socio-economic groups cannot afford. Low socio who are belongs to low socio-economic group, they don't have that much of funds or money to purchase this kind of food products such as nuts, milk products, etc. And this is the main cause for widespread riboflavin deficiency in the country. In very poor or low economic groups, persons are very much affected in this riboflavin deficiency due to the um, due to the less low socio-economic status. Then alcoholism, malabsorption, tuberculosis, hypothyroidism, and chronic infections associated with ariboflavinosis. Others factors are also there. One is who are in alcohol, who are taking alcohol, then tuberculosis, then hypothyroidism, any hormonal deficiencies they are suffering from, they are also affected in this riboflavin deficiency or ariboflavinosis. Treatment is oral administration of 5 to 10 mg of riboflavin daily is often satisfactory to treat riboflavin deficiency. Then we will give 5 to 10 mg of riboflavin daily through dietary or through supplement. Then parenteral riboflavin may be given in suffering from malabsorption. Preventions are improvement of diet, ensure adequate riboflavin daily in the most rational solution to prevent riboflavin deficiency. Then riboflavin content foods are pulses, nuts, milk products are very expensive. Supplements of riboflavin to vulnerable segments like pregnant women are also recommended. Then we will get which type of food, then nuts, milk products, pulses, etc. contains riboflavin. Then pellagra. Pellagra was considered to be infectious disease until the early 20th century. It was only in 1970 at Joseph Goldberger succeeded in providing that the disease was caused by nutritional deficiency. Pellagra is a disease that occurs when a person does not get enough niacin or vitamin B complex or tryptophan and amino acids in their diets. So pellagra is the disease of um, pellagra. Pellagra is the niacin deficiency. When a person is suffering from niacin deficiency, niacin, then he or she would suffer from pellagra. Pellagra is a disease that occurs when a person does not get enough niacin or tryptophan in her diet. Two types of diets causes pellagra or niacin deficiency. One is niacin and other one is tryptophan and amino acids. Both are if we are deficient, if we are not taking proper amount of tryptophan or niacin, then we will suffering from pellagra. Then it can also occur if the body fails to absorb these nutrients. Pellagra due to niacin deficiency and very common in countries like Mexico, where maize was the staple food. There maize was the staple food. Mexico, the staple food was maize. Niacin was demonstrated to the anti-pellagra factor in 1937. Then symptoms are sign and symptoms are pellagra is seen generally in individual in the age group of 20 to 50 years. Pellagra is seen in the age group of 20 to 50 years in both sexes, both male and female. To start treatment, the non-specific symptoms like weakness are there, loss of appetite, then nausea, early fatigue, and gastrointestinal disturbances there, anxiety there, sleeplessness are there. All these kinds of symptoms are seen in pellagra in niacin deficiency. It's sometimes reported that patients at mental hospital may be suffering from the pellagra or niacin deficiency or dermatitis, diarrhea and dementia. 3 Ds are there. The classification manifestations of niacin deficiency are 3 Ds are there. One is dermatitis by skin diseases. Second one is diarrhea, loose motion, and third one is dementia, neurological disorder. Then 3 types of Ds are causes and can lead to death in 4T due to the deficiency of niacin. So if question was arise that what is the symptoms or what are the diseases caused due to niacin deficiency, you have to write one is dementia, one is dermatitis skin diseases, second one is diarrhea, third one is dementia. Then the dermatological changes called pellagra is known as dermatitis and pellagra is in type area exposed to sun. One of the area where the peoples are mostly exposed in sun, there occurs dermatitis but dermatosis in pellagra. It is in an exposed part of the body like upper and lower extremities, the face, neck, etc. and bilateral. If the person was if the person was niacin deficiency and he or she was exposed in sun, then the disease occurs known as dermatosis. Part of the sunlight back of the hand and pellagra growths are there. B complex deficiency like glossatitis is very common in pellagra or sore in tongue, and mouth is sore and tongue is brilliant in beef red in color and swollen. Scoliosis and angular stomatitis are seen in niacin deficiency, etc. Simultaneously riboflavin deficiency. In case of riboflavin and niacin deficiency are related to each other, and 3 Ds are there, and also skin diseases are seen. And skin diseases such as scoliosis, glossatitis, etc. are also seen in niacin deficiency. Then clinical manifestations of pellagra in adults are skin, mouth, gastrointestinal tract, central nervous system. Causes are pellagra, the disease closely associated with poverty due to the low socioeconomic group, um, low standard of living and poor environmental sanitation also causes. Causes is poverty, low standard of living and poor environmental sanitation. The disease is associated with poor communities whose staple is either maize or jowar. Whose staple food is maize or jaw. Then maize has low tryptophan content and low niacin content. Our staple feed is rice. In Odisha, our staple feed is rice. In that cases, where maize is the staple food, then the maize contain low tryptophan and low niacin. Who are taking only maize rich food, staple food, or their main course food is maize, then they were suffering from niacin because maize contains low tryptophan and low niacin content. that 30% is bioavailable tryptophan, the amino acid precursors of nicotinic acid of the tryptophan equivalent to nicotinic acid. So tryptophan is an amino acid. It also is the precursors of nicotinic acid, and the daily requirement in niacin thus affected by the quantity and quality of protein in the diet. If you will take good quantity and quality of amino acids or protein in your diet, then niacin will easily absorb in your body. The communities depend on Joar as stable. Pellagra is attributed to metabolic changes caused by excess of amino acids by leucine. Leucine is an amino acid. Pellagra is attributed to metabolic changes caused by excess of amino acids known as leucine. Then pellagra is also observed in alcoholic and those suffering from malabsorption. Those body was not absorb the nutrition properly, or those who are alcoholic, they also unable to their body also unable to absorb niacin in the body. Then treatments are oral administration of 100 to 300 mg of nicotinic acid every day is adequate, except in cases of severe diarrhea. We should exclude the diarrhea persons. Then we should not give 100 to 300 mg of nicotinic acid in case of a diarrheal patients. We should exclude the diarrhea. Excluded diarrhea we should give to those who are niacin deficiency. We should give 100 to 300 mg of nicotinic acids rich food every day. Nicotinic acid means rich in high amino acid but high protein rich food. Then riboflavin and paroxetine is taken neurological manifestation. Treatment dramatic in the case of mental symptoms, improvement 2 to 3 days a week. Including B complex vitamins are very much necessary. Then dementia is there, diarrhea is there, dermatitis is there. Then all kind of neurological problems are also there. We should take B complex rich vitamins in every day in our diet. B1, B2, B3, all are we should balance and take every day in our diet. Preventions are replacement of the jowar and maize with cereals containing good quality protein can prevent pellagra. We should replace jowar, jo- uh, jaw and maize with the cereals containing good quality protein can prevent pellagra. Development and measures low tryptophan content and niacin content. Acha. Replacement of jowar and maize with cereals containing we should replace jowar and maize instead of wheat products. Good quality protein can prevent pellagra. Development of propagations of strains of jowar that are low in leucine also. Leucine, one of the best amino acids. Low in leucine could be one of the approach. In area which are endemic to pellagra, fortification of food with niacin is another alternative. Where the endemic areas of pellagra, where the pellagras are very much spread in the community, then how could we control the pellagra in that community? Then we should give fortification of food with niacin is alternative. We should give fortified food of niacins. Then the quality of diet, reduction in the consumptions of maize and joyous pellagra has been abated. Then folic acid and B12 deficiency. Folic acid and B12 are essential for the synthesis of nucleic acids and amino acids. In the recent past, folic acid is considered to be important to prevent neural tube defects in fetus. When the fetus is in mother's womb, then iron, if the deficiency of iron and folic acid is in, then at the time of childbirth, the child with neural tube defects in fetus is seen at the time of childbirth. Childbirth ବେଳେ ତାର neural defects हुए, neurological ର spine ର defects ଆସେ. If the mothers were not sufficiently take folic acid and vitamin B12 in her pregnancy period. Pregnancy period रे vitamin B12 and folic acid ନ ନେଇଥିଲେ neural tube defects in fetus ରେ ଦେଖାଯାଇଥାଏ ବା ହୋଲ୍ ରହିଯାଇଥାଏ ନ୍ୟୁରୋରେ. In this concept, it is important for study about the condition. Clinical manifestations are deficiency of folic acid and water soluble vitamin of B complex group leads to megaloblastic anemia. Then if the folic acid and B12 deficiency is in a person, then we should call as megaloblastic anemia. Megaloblastic anemia, the anemia with red blood cell and the larger than normal. With red blood cells are in a shape, in a large shape, but with the red blood cell and that are larger than normal. The red blood cell shapes are one of the shapes. They were enlarged with number of cells. Number of cells are enlarged due to megaloblastic anemia and resulting from the deficiency of folic acid or vitamin B. Common in iron deficiency anemia, folic acid deficiency observed in high of 40 to 50% anemia in pregnant women at the time of pregnancy. Then in pregnancy time we see that pregnant women are 50 to 40 to 50% pregnant women are suffering from anemia. Vitamin B12 deficiency, on the other hand, known as pernicious deficiency. When we observe that one person is vitamin B12 deficiency is in, then it is known as pernicious anemia. And when the folic acid deficiency, it is known as megaloblastic anemia. And then iron deficiency is known as anemia. Pernicious anemia is caused by lack of intrinsic factor substance needed to absorb vitamin B12 from gastrointestinal tract. Then lack of intrinsic factor, a substance needed to absorb B12 in the from the gastrointestinal tract. The folic acid should be absorbed by the body due to the lack of intrinsic factor in the food. Necessary for the formation of RBC, inadequate vitamin B12 gradually affects the sensory and motor nerves, cause neurological problem. Vitamin D deficiency also causing neurological problems, and vitamin B12 needed nerve cells and blood cells for their function properly. Vitamin B12's functions are, it needed to form well functions of the nerve cells and blood cells, they need vitamin B12. So B12 is needed by nerve cells and blood cells for them to function properly. Then psychotic changes, children who are breastfed for longer period, anemia occurs as a result of dietary deficiency of vitamin, growth retardations are seen, mental apathy are seen, etc. Causes. Causes is dietary deficiency is the main causes of folic acid deficiency. Folic acid is available in green leafy vegetables, liver, meat and pulses. Both animal sources of both animal sources of folic acid there as well as plant sources are there. Plant sources, green leafy vegetables, animal sources, liver, meat, etc. And pulses are also plant sources of folic acids. Then, however, considerable destruction of the vitamin occurs during when we will reheat the green leafy vegetables, reheat the folic acid rich foods, and again more times, then it loses its folic acid content. Then deficiency occur when there is impairment of absorption of folic acid in pregnancy and increased demand during infancy due to growth and pregnancy. Prolonged use of anticonvulsants and infections and infestations may be important. If you are suffering from any infections, any bacterial, viral or any protozoal infections, then body is unable to absorb folic acid from the food. On the other hand, vitamin B12 deficiency occurs due to absence of intrinsic factor in gastric mucosa. Intrinsic factor is a protein the body uses to absorb vitamin B12. Intrinsic factor is a one type of protein and the body uses to absorb vitamin B12 in our body from the gastrointestinal tract. When gastric secretion due to have enough intrinsic factor, vitamin B12 is not adequately absorbed. Do not have enough intrinsic factor, one type of protein, then the body will unable to absorb vitamin B12, resulting in pernicious anemia and other problems related to low level of vitamin B12. In addition to pernicious Pernicious anemia, other causes of vitamin B12 deficiency are nutrition. Since vitamin B12 is available in animal foods, deficiency possible in pure vegetarian vegan items. Vitamin appears to be derived mostly from fecal contamination of food. Further, poor diet in infants or poor maternal nutrition during pregnancy cause this deficiency. Folic acid deficiency is very much seen in poor diet in infants and maternal nutrition, or in case of pregnant women and in lactation women. Three groups of people are seen. Uh, uh, Folic acid deficiency are seen in these three groups of people. Then infections, intentional parasites, bacterial growth are also another cause to unable to absorb uh, folic acid in our body. Then third one is gastrointestinal disease, so stomach removal surgery, celiac disease, Crohn's disease, all kind of abdominal disorder or abdominal diseases. The body is unable to absorb that much of folic acid in our B12 in our body. It is B12, B12 in our body. Drugs, neomycin, tuberculosis treatment with para-amino salicylic acids. These types of drugs also hindrances to absorb vitamin B12 in our body. Okay. Then metabolic disorders such as homocystinuria, methylmalonic aciduria, etc. Metabolic, some of the metabolic disorders are there. All kinds of metabolic disorders. In cases of you are suffering from any metabolic disorders, there is less chances to absorb vitamin B12 in our body. Preventions of folic acid and vitamin B12 deficiency. Then supplementation with folic acid along with iron is one of the best strategies that are adopted by the government to prevent or control anemia or folic acid deficiency. To control anemia and folic acid deficiency, supplementation is very much necessary with good proper iron folic rich food. With iron folic rich food, we should give supplementation of iron and folic acid is also necessary to good absorption in our body. Then most rational approach to prevent folic acid deficiency is to improve the daily diet by ensuring food rich in folic acid, green leafy vegetables, pulses and meat products. As for vitamin B12 deficiency, consumption of little as 250 ml of milk every day would suffice to prevent vitamin B12. The person should take 250 ml of cow milk every day to prevent vitamin B12 deficiency. Then take green leafy vegetables, pulses, meat products, as well as you take 250 milk every day to prevent vitamin B12 deficiency. Then you should the person should take all varieties of foods in her diet, such as green leafy vegetables, cereals, pulses, milk items, meat items, etc. Then scurvy. What is scurvy? It is considered to be due to poor intake of fresh foods, such as characters of spongy bleeding, vitamin C deficiency. When the person is suffering from vitamin C deficiency, then scurvy was seen in the body. Middle ages causing damage to armies in Europe. Then symptoms are spongy bleeding, gums are there. Then joint pains, fatigue, depression, tenderness of bones, etc. Bone related problems are there. Joints pains are there. Facial hemorrhages are there. Common symptom like around hair follicles along with the gums, nails, etc. It includes diseases of the nails, hairs, joints, etc. is known as scurvy. In neonates, in neonates, vitamin C deficiency is characterized by tenderness of lower extremities and hemorrhages in the cortochondrial cartilages, and fever, irritability, bleeding with muscles, nail beds is observed. Vitamin C deficiency can lead to reduced ability of fight infections, reduced capacity of healing, and mild anemia also seen. when the person is suffering from vitamin C deficiency, then it reduces to fight infections, it reduces capacity of healings, and it also leads to mild anemia, because due to deficiency of vitamin C, iron cannot be absorbed in our body properly. That's why in cases of vitamin C deficiency, our body is unable to absorb iron in our body. Sorry, vitamin C. If vitamin C deficiency is seen, then our body is unable to absorb iron in our body. Causes of scurvy. Deficiency of ascorbic acid is not a common as it used to be before. However, vitamin C is heat liable and water soluble. Vitamin C is water soluble vitamin. B and C are water soluble. It cannot be stored in our body for a longer period because it is a water soluble vitamin. It excretes through our sweats, urine, etc. And oil soluble vitamins are stored in our body for few days. Hence, faulty cooking practices, inadequate consumptions of fresh vegetables and fruits are the major reasons of vitamin C. Citrus fruits, faulty practices again and again to cook the foods, etc. Inadequate consumption of fresh vegetables and fruits are major reason for vitamin C deficiency. Then citrus fruits, amla, guava, green leafy vegetables are good sources of ascorbic acid or vitamin C. Then this is the box number 5, causes of vitamin B complex and C deficiency. Inadequate intake of vitamin C, ascorbic acid in the diet, faulty cooking practices means again and again lots of many times reheating the vitamin C rich food, malabsorption, prolonged use of drugs, alcoholism, increased demand. Then treatment. Scurvy in children is cured by 10 to 25 mg of vitamin C 2 to 3 times a day. It may take 2 to 3 weeks for complete treatment. We should give 10 to 20 mg of vitamin C in supplementation or in through food. 2 to 3 times a day. Prevention. Scurvy is no more a public health problem in India. However, the role of vitamin C is promoting iron absorption and as a potent antioxidant has been recognized. It is also known as antioxidant because it enhances our immunity to fight against diseases. To fight against diseases, that's why we will call vitamin C as antioxidant. A regular intake of fresh vegetables and fruits is the most rational and suitable methods to preventing vitamin C deficiency. The common sources of vitamin C that are readily available are citrus fruits, lemon, orange, guava, amla, tomato. Citrus rich fruits, it contains vitamin C. Then last one is rickets and osteomalacia. Rickets has been known to be a nutritional disease for over 100 years, and cod liver oil was known to prevent rickets in India. Rickets is not seen in community survey, although it is seen in hospitals. The symptoms are rickets occurs generally in growing children. In growing children, rickets are seen who are not adequately exposed to sunlight due to the vitamin D deficiency. Rickets is caused. The cause of rickets are due to the deficiency of vitamin D, and who were less exposed in sunlight, they were suffering from rickets. The signs and symptoms of deficiency are mainly due to inadequate mineralizations, while in the children it is known as rickets. In adults it is known as osteomalacia. Osteomalacia in adults, and in child we will call the disease as rickets. Then bones are soft and easily bent, and therefore deformities are common. In growing children, swollen, painful, growing ends of long bones are wrist, ankles, etc. are characterized it. The bones cannot be stand even normal. It is in moon shape. It is in curve shape. In cases of rickets and osteomalacia, bones are not in straight form. It is in curve shape. Then bow legs and knock knees are there. In the ribs, the autochondrial junction was swellings which appears like rosary referred in rachitic rosary is found. Osteomalacia occurs due to the calcium depletion in women of childbearing age due to multiple pregnancies and particularly among those observing pardas. When in Muslim communities they were using parda systems, that's why the sunlight is not exposed properly in their body, so rickets osteomalacia increases in Muslim communities. And in cases of due to the not taking spaces in between childs in the child bearing ages and multiple pregnancy are the other causes. Then women may complain of pain in bones and lower extremity, back back, difficulty in working. Due to the softness of bone, bone becomes soft and can easily bend, leading to bony deformities. Muscular hypotonia is there, low muscle tone is there. Causes are due to the inadequacy of vitamin D, due to the deficiency of vitamin D, and it gives to the hormone 124 dihydroxy D3, the primary functions of which are regulate serum calcium. One of the main causes of the inadequate exposure to sun. Infants who are solely breastfed are not exposed to adequate sunlight, and premature infants are more prone to rickets. Who are more prone to rickets? Who are babies who are on breastfed and they were not exposed to sunlight. They are suffering from rickets. Osteomalacia can occur due to some gastrointestinal disturbances and chronic renal diseases. In cases of osteomalacia, gastrointestinal disturbances are there, and some chronic renal diseases are also the cause of vitamin rickets or osteomalacia, and which are maybe impaired of absorption of calcium and synthesis of vitamin D. In some cases of renal diseases or kidney diseases, body was not properly uh, production of calcium and balancing of calcium and vitamin D. Treatment is both rickets and osteomalacia requires administration of vitamin D and ensuring adequate calcium intake. Administration of vitamin D जो doses are there, supplementation of vitamin D are there with adequate exposure to sunlight as well as take sufficient amount of calcium in the diet. Prevention. Adequate exposure to sunlight is absolutely essential for prevention of rickets and osteomalacia. First one is D2. It absorbs in our body vitamin D. Then other we will get from oil soluble fats. Rich food. Then diet provide adequate amount of calcium daily. The awareness among the community should be increased so that the diet contain food which provide calcium. Among the food, milk is the best food. In the calcium, milk is the best food. Milk um, um, associated to milk rich foods are also there. Curd, milk, then cheese, etc. are also very good sources of calcium. Small fishes, green leafy vegetables. Then sunlight is very much necessary to absorb calcium in our body. Then fluorosis. Fluorosis is a chronic public health problem. It is caused by excess intake of fluoride through drinking water or food products or industrial pollutants over a longer period. Fluorides is coming from the drinking water and the food product industrial pollutants over period. The fluorosis we will get through the food and the food from the industrial pollutants, etc. Fluorosis is the endemic in several parts of the India, like state of Uttar Pradesh. In those water, fluoride is in this area is the endemic part of the India. Several parts in India is the endemic. माने से जगह रे बहुत मात्रा से पानी रे फ्लोराइड जो उठी आसे तो सेटा एंडेमिक भली आमे नौ कारण सेठी समस्त को फ्लोरोसिस हुए. It is a crippling and painful bone disease caused by due to consumption of excess fluoride in water. If you will consume more if you will consume excessive fluoride rich water, then we will suffering from fluorosis. It is a crippled and painful bone disease. It is a crippling from ଯେମିତି ଘୁଷୁଡ଼ି ଯେମିତି ଯାଆନ୍ତି ମାନେ lower limbs ର ଯେମିତି neurological problems ହୁଏ, painful bones ହୁଏ in consumption excess fluoride water. According to scientific survey, skeletal fluorosis in India occurs when the fluoride concentration water increase. Some areas are there where fluoride are coming through the water, then it is endemic also in that community, in that particular area. All peoples are suffering from fluorosis due to the lots of fluorides, their consumptions of fluorides through the water in their body. ତାଙ୍କ ବଡ଼ିରେ ପାଣି ଦ୍ୱାରା ଫ୍ଲୋରାଇଡ଼୍ଟା ବହୁତ ମାତ୍ରାରେ ଯାଏ, କାରଣ ସେଇ ଏରିଆରେ ସେ ଗୋଟେ ଟାଇପ୍ର ହିଁ ପାଣି ଆସିବ, ଫ୍ଲୋରାଇଡ଼୍ ରିଚ୍ ପାଣି, ସେଥିପାଇଁ ଏଣ୍ଡେମିକ୍ ହୁଏ. Symptoms are dental fluorosis are there, skeletal fluorosis are there, non-skeletal fluorosis are there. Dental fluorosis is occurs in children of both the sexes exposed to high fluoride intake even before the dental mineralization is complete. Their teeth are deformities, teeth are there, then whole type of teeth are there, and teeth colors changes ମାନେ ଦାନ୍ତର ବହୁତ ପ୍ରକାର deformities ଦେଖାଯାଏ, ଯେଉଁଥିରେ କି ହୋଲ୍ ଭଳିଆ ଛୋଟ ଛୋଟ ଛେଦ ଭଳିଆ ଏମିତି ହେଇଯାଏ. ତ ସେଇଭଳିଆ ଯେତେ ଏକ୍ସେସିଭ୍ ଆମେ ଫ୍ଲୋରାଇଡ଼୍ଟା ୱାଟର ଥ୍ରୁରେ ଇନଟେକ୍ କରୁ. Dental fluorosis, then skeletal also like this. Skeletons also like hole-like structure. Non-skeletal fluorosis are there. Dental fluorosis are occurs in both sexes, both male and female, and intake of fluoride-rich water, dental mineralization is complete. Yellowish brown streaks or spots can be seen on the molting of teeth skin, which appears are yellowish and brown spots are there. Dental molting is irreversible and to permanent teeth. Then skeletal fluorosis is joint pains, musculoskeletal dysfunctions, and deformities are there, bending of the bone, pain joints, etc. Non-skeletal fluorosis is gastrointestinal complaints, etc., and may overlap with other diseases leading to misdiagnosis. Causes are high content of fluoride in water, in drinking water. Foods also contribute significantly fluoride content to diet. We should avoid fluoride-rich water. We should avoid the patients not to drink fluoride-rich water or fluoride-rich food. Cereals and vegetables grown in area which are endemic in fluorosis, those soils are contain fluoride, then their products or cereals and vegetables grown in this area also highly rich in fluoride. That's why these are the endemic for fluorosis, which are endemic for fluorosis because they consume this type of fruits, vegetables, and waters. They were endemic for fluorosis. Contain higher amount of fluoride. It is reported that as much 85% of total fluoride intake is contributed by the food. Poor socio-economic condition and poor nutritional status may be associated with fluorosis. Poor socio-economic conditions and also poor nutritional status are also the causes of fluorosis. Then remember, fluoride can enter the body through drinking water, food, toothpaste, mouth rinses. We are using mouth freshener and other mouth cleaner also we are using, and other dental products, drugs, and fluoride dust and fumes from industries using fluoride containing salt, hydrofluoronic acids. These are the causes of fluorosis. Preventing, ensuring that drinking water has safe level. Fluoride is the best solution of controlling endemic fluorosis below 1 ppm. If we will examine the water, then we should get, when we will get below 1 ppm fluoride is the best solution for controlling endemic fluorosis. Supply of water from river, dams, canals, or other sources of surface water. One of the method to adopt extensively in areas which are highly endemic. Another method is defluoridation, removal of fluoride of water by appropriate treatment of water. We should add something into the water that could reduce the fluoride level. It is known as defluoridation. Domestic methods are Nalgonda technique and Prashanti techniques are perhaps simple and acceptable. These are the methods, several domestic methods to defluoridation. Then, while in the first method, lime and alums are added to the water, in the latter, activated alumina is used to passing water. Commercial defluoridation is very expensive and not practiced frequently. Such as Nalgonda technique and Pasanti techniques are very expensive, and we should add some lime means chunna, and alums are added to water, then fluoride contents will be reduced in our water, drinking water. What is litharism? What is litharism? Litharism is it contains toxic amino acids which pose serious health problems in mankind, and it is found the Litharus sativus. Litharus sativus in Kesaridal could be considered to be the public health significance consequences to be continuing consumption of this Kesaridal. Most of the areas people are taking Kesaridal as instead of other pulses. They were suffering from lethargism. Then symptoms are diseases in among young adults in the most productive age. And young persons are affected in this letharism, insidious in nature, and altered gaits and pain in the lumbar region. Lumbar region pain, they found pain in lumbar region, back spasticity and paralysis occurs. Then earlier symptoms of muscular spasms in the calf muscle tremor. Then it is initial stages affected may be able to walk with the help of single stick. It means due to the consumption of kesari dal class. Due to the consumptions of kesari dal, one should na asli. We should we should we should we should suffering we should then paralysis occur. Then the disease is caused due to the exclusive consumption of Kesaridal over a longer period of time. If you will take Kesaridal for longer period, then litharism occurs. The pulses contain toxic amino acid known as beta oxyl aminoalanine or BOAA. Due to this toxic amino acid content in Kesaridal, the person should, when the person is taking longer time, then they will suffering from litharism. In part of Madhya Pradesh and contiguous area of Uttar Pradesh, Bihar, they were suffering from these diseases because wheat being a hardy survived despite damage to the wheat crop. Due to the damage of wheat crop, they usually depend on Khesari dal's rotis for their survival in Madhya Pradesh. That's why in their area, litharism is seen very more quantities they were seen litharism seen in Madhya Pradesh. Distribution of cereals, affordable rates and systems. Preventions in most of India, cultivation of Kesaridal crops has declined over time because of bans of this scale under Prevention of Food Adulteration Act. Under the Food Adulteration Acts, they banned the Kesaridal, and instead of Kesaridal, they distribute cereals at affordable rates and public distribution systems in BPL cards in etc. Laborer to Kesaridal. Instead of Kesaridal, they should distribute other pulses items, cereals items, etc. The toxin being water soluble and can be removed by parboiling. When these toxins, BOAA toxins, are water soluble and can be removed by parboiling. If you will parboil that cereals, then or pulses, then it will reduce the toxin. At the domestic level, steeping of the pulse in boiling water and drying the same removes most of the toxin, not the whole toxin. Most of the toxins are removed by boiling and drying method. Then unit 4, health economics and economics of malnutrition. What are health economics and malnutrition of health economics? What is health economics? Health economics concentrate on application of the principles and rule of economic in the sphere of health. Then analysis of evaluation of health policy, health system from an economic perspective. It includes health system planning, market mechanism, demand and supply of healthcare, economic evaluation of individual diagnostic and therapeutic procedures, determinants of health and evaluation, etc. Then, what is health economics? Health economics and we should plan, we should properly plan for a program. Then we should health system planning. Then we should follow the market mechanism. Then what are the demands and supply of healthcare? Then economical evaluations are there. We should buy, we should purchase this, we should supply. Then it is the what are the economic evaluation of individual diagnostic and therapeutic procedures. Then determinants of health and its evaluation. Then after supplying these deliveries, what are the results occurs? It also seen. Evaluation of performance of healthcare system in the quality and efficiency. We should follow the quality efficiency after uh, um, after taking this kind of first planning, then market mechanism there, then demand and supply we should follow, then after economical evaluations are there, then evaluation and performance are there, then results, whether it gives good results or bad results we should evaluate. It is known as health economics. Here 5.1, direct capital, land, building, operating staff there, indirect production loss, transportations, boarding and lodging, intangible, pain and suffering, griefs are there. Then consequences of health problems are physical functions. One is morbidity, mortality, disability, resources use, cost averted by healthcare system in the form of treatment, productivity loss averted. Then social emotional functions are there, pain, suffering, grief, changes in quality of life, friends and family. These are the cost of managing health problem and consequences are there. Then malnutrition and its economic consequences. What is malnutrition? Malnutrition can be defined as pathological condition resulting from a relative or absolutely deficiency excess of one or more of the essential nutrients. When the body deficient excess more or one of the essential nutrients and protein, carbohydrate, protein, fats, vitamin, minerals, water, fiber, etc. are important nutrients. If more than one or two nutrients deficiency in our body sin, if we will see two or more nutrients are deficiency in our body, then we called as malnutrition. These categories are undernutrition as well as overnutrition. Both are malnutrition. Both are coming under malnutrition. Then undernutrition, overnutrition, imbalance, specific deficiency. One is undernutrition, one is overnutrition. Third one is imbalance, specific deficiency. If specific deficiency is seen, it is also known as malnutrition. Undernutrition, inadequate nutrition, overnutrition, excessive nutrition are there, imbalance, specific deficiency, disappropriate, relative or absolute lack of individual nutrients are there. Then causes of malnutrition. What are the causes of malnutrition? Malnutrition are classified as immediate, individual level, underlying household or family level. Then Socio-economic status is also causes. Due to the low economic status, they were unable to purchase good quality or kind of nutrients, and which are added in their daily diets. Other factors, the individual and household level include availability, accessibility of food. Availability also most important. The food and poor knowledge about balanced diet, proper knowledge is also given due to the lack of knowledge, due to the poverty, lack of awareness. Then food availability is also there. It is the core causes of malnutrition. Poverty is there. Uh, Poverty and hunger mutually causes devastating effects. Then consequences of malnutrition are terms of illness and death in all age group. Consequences are children, pregnant women, nursing mother, elderly are particularly vulnerable to these effects. What are the groups of peoples who are mostly affected with malnutrition are vulnerable groups are pregnant women, nursing mother, children, elderly person. These are coming under vulnerable group which are mostly affected in malnutrition. Then malnutrition contributes to more than half of child death worldwide. Malnutrition contributes to more than half of child death worldwide every day. That's why risk of death rises as the grade of malnourishment increases among children from mild to moderate to severe malnourished. To mild to moderate to severe malnourished. Risk of death rises through the different groups such as mild to moderate to severe malnourished child. The synergetic contribution of malnutrition to child mortality is consistent across populations and can be estimated at the country level of weight force prevalences data. Consequences of malnutrition are given in table 5.3. Pregnant lactating mother, PEM, IDD, VAD, IDA, folate deficiency, calcium deficiency, insufficient weight gain in pregnancy, maternal anemia is there, maternal mortality is there, increased risk of infections are there, night blindness, low birth weight, all are coming under these consequences. Then integration cycles are there, adults are there, then elderly. These are the four vulnerable groups of people who are mostly affected with malnutrition, and consequences are seen. One is pregnant lactating mother, intergenerational cycles, then adults, then elderly persons. Then five, three and four interventions of malnutrition and government expenditure and interventions are for pregnant and lactating mother in ICDS, then National Health Missions, Janani Suraksha Yojana, Pradhan Mantri Matru Bandhana Yojana, National Nutrition Anemia Control Program. All those are the schemes were programs organized by Government of Odisha or Government of India. For targeted groups are pregnant lactating mother and 0 to 3 years child, children in between 3 to 6, school going preschool child 6 to 14, adolescent and 11 to 18 adults. Lots of programs are going on by our governments, ICDS schemes, NHM schemes, midday meal plans, Sarva Shiksha Abhijana, Rajiv Gandhi Scheme for Empowerment in Adolescent Girls, Mahatma Gandhi National Rural Employment Generation Scheme, etc. For adults, given lots of schemes, and school going child, midday meal plans, Sarva Shiksha Abhijans are going, adolescent girl, Rajiv Gandhi Scheme for Empowerment and Adolescent Girls are going, Kishori Shakti Yojana is going. Then in 3 to 6 years, ICDS programs are going on. NHM, Rajiv Gandhi National Crash System, sanitation campaigning there, National Rural Drinking Water programs there. You should remember this kind of schemes governed by our government, and review of existing program was schemes, interventions for malnutrition by government expenditure on interventions. Government the program is organized by government and distribute lots of nutritional supplement some nutritional supplements, then medicines and other health educations to this group of people. तामाने हमको गवर्नमेंट यही सब स्कीम थ्रू रे विभिन्न टार्गेटेड ग्रुप्स जो रहिले से मानक सब एजुकेशन, न्यूट्रिशन एंड मेडिसिन्स. Then 6.2 is demographic transaction and demographic cycle. What is demography? Scientific study of human population is known as demography. When we will survey, when we will study the human population in a particular area is known as demography. It focuses attention on three rapidly observable human phenomena: changes in population size, growth or decline, composition of the population, and distribution of population in space. First of all, we have to survey the what is the birth and death rate or growth or decline rate. Then compositions of the population, whether how many male person are there, female person are there, children are there, composition of the population, and distribution of population in space, and distribute the populations in a space. These are the three types of demography are there. So then where do you get all the information related to problem? In India, we are get demographic statistics are there, population census, national sample survey, registration of vital events, and demographic studies are there. When the child take birth in a hospital, then there also maintain one vital records there, birth records are there. When the person is dead, then death record is there. When marriage records are there, all kinds of records are available. All kinds of registers are maintained in different areas in different form. Then we will get all total. This comes under in demographic statistical rate. In demographic studies, it comes under all these vital statistical records that comes under demographic studies. Demographic studies रे हमर जन्म पंजीकरण, then the birth date, death, then marriage registrations, all kind of registrations are kept in an area, गोटे एरिया रे जोटा रोची ताकू demographic survey, we will call as demographic survey. Then what is demographic transaction? The whole process of change with regards to population size and characteristics is called demographic transaction. Whole process of change with regards to population size and characteristic is called demographic. In order to understand this term, demographic cycle is population grows in size. History of world population suggests the demographic cycle 5 stages. First stage is high stationary. The stage is characterized by high birth rate and high death rate, neutralizing each other as the population remained sanitary. India was staged till 1920. The first stage is high stationary is what? Carried by high birth rate and high death rate. If in a community, high death rate death rate is very high and the birth rate is also very high. Population is growing on and death rate is also going on. This is known as first stage, known as high stationary. Then second stage, early expanding. The death rate begins to decline. Death rate was decreased, but birth rate remains high. Where birth rates are going, population is going on, and death rates decline means overpopulation. This is known as second stage, resulting in increase in population. Then third stage is late expanding. The death rate declines further and birth rate begins to fall. Then in case of death rate also reduced, means healthy people are living in healthy form, and birth rate begins to fall. Also, we should control our population. Birth rate also fall and death rates also fall. The population continues to grow because birth exceeds death. India appears to be stage in movement where there is high growth with definite sign and slows down. This is called fast third stage. Then fourth stage survey is low stationary. This stage is characterized by low death rate and low birth rate. As a result of which the population becomes stationary. This is called the zero population growth. This is known as zero population. No death rate also decline and birth rate also low. This is known as zero population growth. Most of the developed nations have undergone demographic transition shifting from high birth rate and high death rate to low birth rate and low. From high birth rate, high death rate to they should rates shifting to the high death rate and low birth rate and low death rate. माने ଯେତେବେଳେ ହାଇ ବାର୍ଥ ରେଟ୍ ଆଉ ହାଇ ଡେଥ୍ ରେଟ୍ ଯେଉଁଠି ବଢ଼େ ତ ସେଇ ଜାଗାରୁ ସେମାନେ ସିଫ୍ଟ କରିଦେଲେ ଲୋ ଡେଥ୍ ରେଟ୍ ଆଣ୍ଡ ଲୋ ବାର୍ଥ ରେଟ୍. It is very good. The fifth stage is declining. There is more death than birth, resulting in decline in population. And fifth stage is death rate is very more, resulting in population. Then what are the population belonging to? Death rates are increasing. It is known as declining stage. Negative growth phase. It is known as negative growth. It means the diseases are rapidly spread in that area, in that community. When the diseases are spread, death rate is the more and according to the birth rate ଯେତିକି ଥିବ ବହୁତ ଡିଜିଜ୍ରେ ଏଣ୍ଡେମିକ୍ ଡିଜିଜ୍ରେ ବହୁତ ସାରା ମରିଗଲେ ତ ସେଥିପାଇଁ ତାକୁ ନେଗେଟିଭ୍ growth phase କୁହାଯାଏ. This is known as negative growth phase. These are the 5 stages of demographic cycle which is very important. What is fertility behavior? Actual bearing of child is termed as fertility. Actual bearing of child in an childbearing age in between 15 to 45 years is termed as fertility. A woman reproductive period is roughly from 15 to 45 years, period of 30 years. Information on fertility in India indicates that the average woman gives birth to an average of 6 to 7 children. If her married life is uninterrupted, if the marriage life is very good or very strong bonding, then she can give birth to 6 to 7 children in her reproductive periods. Okay. The high fertility of India is attributed to universality of marriage. Lower, what are the causes? What are the causes of fertility behavior? Sorry. Fertility behavior or factors which affect fertility. What are the factors which affect fertility? Age at marriage. The age at which a female marries and ends the reproductive period of life has a great impact on her fertility. National data from Register General is who marry before the age of 18 give birth to a large number of children than who's married later in life. Who are married in very early age or below 18 years of age, then it gives large number of children are she gives birth to a large number of children. The population is growing on. That's why demographic was estimated that if marriages were postponed from the age of 16 to years to 20 to 21 years of years, the number of births would decrease by 20 to 30%. Then she should ban the age below 16 years, then she should fix the age of 20 to 21 years of marriage. That's why the population should be decreased or 20 to 30% were decreased. अर्ली एज्रे मैरेज कले बहुत सारा पॉपुलेशंस बढ़े आउ से एजटा को जब घुंचे कि आम टिके 20 to 21 years करदेवा तेरे number of birth rates are decreased. Then duration of married life. Demography studies indicate 10 to 25% of all birth occurs within 1 to 5 years of married life. In between 1 to 5 years of married life, 10 to 20% give childbirth. Then 5 to 50% of all birth within 5 to 15 years married life. Birth after 25 years of married life are very few, and therefore family planning efforts should be concentrated in the first few years of married life in order to achieve tangible results. Duration of marriage, then after childbirth, after giving child 2 to 3 child, after giving birth to 2 to 3 child, then family planning, planning ଦେବି ଆଜି ଆଜି ଦେଇଦେଲି ମୁଁ ଏ ଯୋଉ ହଳଦିଆ ସବୁ କାଲି ଆଣିଦେବେ କି? Then married life, we should follow the contraceptive systems, or we should to control birth rate, we should follow some of the systems are there. Then spacing of children, we should give spacing of children in between 3 to 5 years after a previous birth. We should give space less than 3 years of age. Then literacy. Women literacy is one of the critical factors to determine. Women's literacy is very much important. We should educate the we should educate the women about the maintaining spacing between second child, and lots of things about this kind of growing populations. I mean, child literacy is very much important. How to keep spacing between one or more child. One ମାନେ ଗୋଟେ ଆଉ ଦିଟା child ଭିତରେ କେମିତି spacing maintain କରିବେ. And economically status is also important point. Total number of child born declines with the increase in per capita expenditure of the household. People in the high economic group view having children as an investment, whereas poor people childs are assessed and source of extra income. So economically status also a important cause of this infertility. um, Economically status means poor people need more more populations for their for the कौन कौन देता को further income, further for long income, for incoming persons she needs to increase their population group. से ता population को बढ़ेले तार income भी ମଧ୍ୟ the interest will be increased when the population will be increased according to the poor people's thought. By low socio-economic person's thought was, if we will increase the population, family populations, then our income will also be increased simultaneously. But in case of high economic group people, they should control their populations. In caste and religion, reported a total fertility rate of 2.62 among Muslims and compared to Hindus. Caste and religions, Muslims have lots of children, and populations are increasing, and in comparison to Hindus. Whereas the total fertility rate amongst Christians were found to be 1%, 1.9%. Among Hindu, the lower caste appears to have higher fertility and higher than the higher caste. Then Hindus is 2, Muslim total fertility rate of 2.6 among Muslims are compared to 2.13 among Hindus. Hindus and Muslims are, in comparison to all religions, Muslims are higher rank in population increasing, and then Muslims, then Christians are very lower. Then nutrition. There appears to be some relationship between nutritional status and fertility level. Well-fed society have low fertility, and poorly fed society have higher fertility. Then nutrition is also is a factor. If you will get good nutrition, then fertility will be increased. If you will get lower poor nutrition, then fertility will be decreased. Then family planning is also factor in fertility reduction in a number of developing countries. We should follow the family planning procedures to limited our to control our populations. Then cultural preference of son. Cultural preference on in Indian society, cultural preference for son is strong, and many couples have another child soon after the birth of the daughter. They should ମାନେ in Indian peoples they need son rather than daughter. ତ ସେମାନଙ୍କର ପୁଅର ଯେଉଁ ଆଶା ଥାଏ ତ ସେଇଭଳିଆ ଭାବରେ fertility was going on to for their son but for their male child ପାଇଁକି ସେମାନେ ବହୁତଟା fertility ତାଙ୍କର create ହେଇଯାଇଥାଏ. ତ lots of population are going to increasing for their male child. ପୁଅ ପାଇଁକି ସେମାନେ for their son they were repeatedly and another child soon after birth for the continue having child until the birth of his son. They were continuing the having children until the birth of his son. Until the birth of the son, they were their fertility was going on. That's why the population was going. The other factors are fertility is affected by the number of physical, biological, social and cultural factors such as place of women in society, value of children in society, widow remarriage, breastfeeding, customs, beliefs, industrializations and urbanization, better health conditions, etc. Then long-term government programs and large amount monies are there. Other factors, social, physiological, biological, etc. cultural factors are there. Then vital statistic and implications of vital statistics in population growth. Density of population, number of person living per square kilometer area is known as density of populations. Infant mortality rate, IMR, number of death of infants under 1 year of age per 1000 live birth. 1000 ଜଣ ଜନ୍ମ ହେଲା ଭିତରେ କେତେ ଜଣ estimated number of live birth per 1000 estimated number of death of infant under 1 year of age in 1000 live birth ଯଦି 1000 ଜଣ ଜନ୍ମରେ କେତେ ଜଣଙ୍କର ହେଲା ତ ସେଇଟା ହୁଅନ୍ତି infant mortality rate or death rate CDR. Annual number of death per 1000 population. Birth rate, number of birth per 1000 estimated mid-year population in a given year. Fertility rate, the number of children that would be born per woman if she were to live to the end of her childbearing year and bear children at each age in accordance with prevalence a specific fertility rate. Sex ratio, number of females per 1000 male is sex ratio. Life expectancy and birth, the number of years newborn children would be live. These are the important definitions are there. Then maternal mortality rate, number of death of women from pregnancy related cause for 1 lakh live birth. Population policy. Then we will study 7.5 direct assessment of nutritional status. Then we should we should take their body measurement or conduct some biochemical test. Commonly using methods for direct assessments are nutritional anthropometric, clinical examinations of nutritional signs, biochemical estimations and dietary assessment are there. 4 kind of methods are commonly used for direct assessment of nutritional status. How will you aware the people about their nutritional status? What kind of nutrition he or she should take according to their age, sex and lifestyle. We should follow the method of nutritional anthropometry. Nutritional anthropometric is Measurement of human body at various ages and level of nutritional status. We should take their height and weight of the persons. Then we should stick some nutritional status. We should point out the what are the nutritional status of that person after taking the height and weight. After taking height and weight of the person, and we get the BMI, etc. Then we will give some nutritional and fix some nutritional amounts or quality nutritional quantity to the person. ଆମେ ହାଇଟ୍ ୱେଟ୍ ଦେଖି ସାରିଲା ପରେ ଗୋଟେ କ୍ୱାଣ୍ଟିଟି ଫିକ୍ସ କରିବା ହ୍ୱାଟ ଏଭର ନ୍ୟୁଟ୍ରିସନ୍ ଦ ପର୍ସନ୍ କ୍ୟାନ୍ ଟେକ୍. Use of anthropometry. What the anthropometry tools are there? Anthropometry tools are consist of undernutrition of vulnerable group of population. Who are the vulnerable group of populations are children, adolescent girl, pregnant women, lactating women, and elderly persons are coming under vulnerable group. Then assessment, monitoring of individual children at regular interval, monthly or quarterly. We should measure the height weight of the children, mothers, vulnerable group of persons. Whether the person is help to early detection of initiating promote remedial measures. Then identification of child who are at risk of undernutrition to target and nutrition action program so that control the extent of undernutrition. We should regular measure the height weight and also meet circumstances. With the help of MUAC tape, we will measure the arrow circumference, and then we should take the remedial measures. If she was coming under undernutrition, overnutrition, we will take remedial measures. Identification of children who are at risk of undernutrition. Mid-term appraisal of terminal evaluation assess whether intervention program has achieved the objective. Assessing nutrition rehabilitations and malnourished children under treatment. If the children is coming under malnutrition, then we will start treatment in early stage. Then common measurement used in nutritional anthropometrics are tools are body weight measurement machines, standard height or grown heel length, mid upper arm work tapes are also used. Body fats. 4 types of tools are measurement routine surveys are there. Body weight, height, mid arm circumference, mid upper arm MUAC. Then body fat. Body weight means we should weight the baby. We should weight the vulnerable group of persons. Then weights are Salter scales are there to measure the infants. Beam scales are there. And then for height measurement, use the height measurement techniques are there. We should measure the height according to the weight. Then child length measurements also there. Crown heel length. Then MUAC by mid upper arm circumference by MUAC tape is also measured. The arm circumference is measured with flexible fiber glass tape of 0.1 cm taken on the left arm. We should measure the person's left arm. We should apply the MUAC tape in the left arm. Hanging freely by the side in the midpoint. The midpoint of the upper arm is measured by taking first the length of the upper arm, then disturbing the counter arm in any way. Body fat. The adipose tissue distribution over a large number of sites in the body. Subcutaneous fats constitute body's main store of energy by reserves. Then we should measure the body fats. How will we measure the body fat? Then first fat folded tricep. Skinfold calipers are there. Skinfold calipers are there. 3-fold, 2-fold, etc. are there. With caliper, we should measure how much extra fats are in a person's body. These are the anthropometric tools. Then methods of assessing nutrition status in an individual. Age assessments are there. More exact assessment of age up to month is possible. Then growth standards are there. According to WHO, standards development result in growth reference studies. And these are the table 2.7.2 is height, weight for girls are there, for boys are there. It is the height and weights of the boys 0 to 60 months according to WHO median values. Determination of nutritional status using MUAC tape. MUAC tape, how will you classification of malnutrition of MUAC tape? You should remember this MUAC tape table. Then MUAC more than 13.5 is normal, 12.5 to 13 point is mildly malnourished, and less than 11.5 or less than 12.5 is severe malnourished requires immediate attention. Then more than 13.5 or 13.5 is normal, 12 to 13.5 is mild, and less than 12.5 is malnourished. This is the MUAC malnutrition classification. Determination of nutritional status using height, weight. And these are also table given here. Methods of classification to assess nutritional status of adults and children. WHO classification, jet score or standard deviation classification for children is there, and Indian Academic of Pediatric classification there. One is done jet score classification and another one is IAP classification is there. And for adults, body mass index we should calculate how much fats are in a adult's body. We should calculate body mass index or BMI calculation. In case of children, we should Z score or standard deviation classification and Indian Academy of Pediatric classification. Low weight, age is full underweight. WHO classification of weight or age is also given in the table 7.5. It is very important. Grade of undernutrition is less than 2 standard deviations and normal, then underweight, then severely underweight is there. Then stunting height for age. According to the age, height is not increasing is known as stunting. Sufficient growth is not there. Growth retardation is known as stunting. Height for age is measure of stunting. It is well known as height for age is less than only when children are exposed to malnutrition. When the child is coming under malnourished, then the stunting is occurs because there is no growth of height according to the weight or age. According to their age, height is not properly increased. The growth is stopped. It is known as stunting. Then second one is weight for height by wasting. According to weight, height is also not good. A measure of weight against height is indicator of wasting. If according to height, weight is not good, it is known as wasting. Protein deficiency is known as wasting. Protein and calorie deficiency is known as wasting. The measurement of weight against height is indicator of wasting. And observe the large number of children who are wasted and emaciated. The short duration of undernutrition. Who are coming under undernutrition? Undernutrition, twos were there. One is wasting, one is stunting. Then BMI is for adult body calculation. BMI chart is also given here for boys and girls 5 to 19 years. BMI classifications is also there. Underweight less than 18.5, less than 18.5. Then normal is 18.5 to 24.9. Then overweight is obese is more than 30 and Class 1 obesity 30 to 39.34.9. Class 2 is 35 to 39.9. Class 3 is more than 40. In Indian Academy of Pediatrics IAP classifications, IAP classifications. All the tables, you should follow all the tables and remember all the tables according to WHO classification of height for age, classification of weight for age, BMI classifications, and WHO classification of weight for age. These are all are important. Then Unit 8, Assessment of Nutritional Status in Community Setting 2. Clinical assessment are there, training and standardization, clinical science and nutritional disorder. One is protein energy malnutrition, PEM, vitamin A deficiency, anemia, goiter, fluorosis, vitamin C deficiency, rickets, essential fatty acid deficiency, vitamin B complex deficiency. Protein energy malnutrition we have already studied in previous classes. Kwashiorkor is there, marasmus is there, vitamin A deficiency, anemia, goiter, vitamin B complex deficiency, C deficiency, active rickets. Then please look on table 8.1 nutritional deficiency disorder and sign and symptoms. Here clearly given here in this table as Kwashiorkor, sign and symptoms are edema, underweight, apathy, irritability, moon face, hair changes color to copper. Then marasmic Kwashiorkor, vitamin A deficiency, all are given in a table of table 8.1. Then we will study biochemical, how we will know the biochemical parameters if the patient is suffering from any diseases, protein energy malnutrition. How will you look after the biochemical parameters, biochemical assessment. Then serum albumin level as the indicator to assess protein nutritional status in children. We should look after the serum level of the persons, the serum level of the children, whether she is suffering from PEM or not. Then we will see the serum level of the child. Deficient or high risk is less than 2.8. If the blood serum albumin level is less than 2.8, it is known as the child is suffering from protein energy malnutrition due to the lower level of serum albumin in her blood. Then medium is 2.8 to 3.4. Then acceptable low risk is more than 3.5. Is good albumin level, no edema is seen. Then vitamin A deficiency, we should three methods of assess vitamin A deficiency. You look after the serum retinal method, relative dose response method, filter paper method. Three methods are there. Then we should follow the table vitamin A status on serum vitamin A level. We should look after the serum vitamin A level of the child. If deficiency vitamin A deficiency is in, then microgram in deciliter less than 20, then 20 to 30 is low, acceptable is more than 30. In anemia, measurement of hemoglobin, then children less than 6 year is 11, more than 6 year is a non-pregnant, non-lactating woman is 12, pregnant woman is 11, lactating woman is 12, and adult male is 13. You should remember these biochemical reports of the affected persons. In anemia, what should be the hemoglobin level? Estimations of iron stores. Estimations of either bone marrow, iron, or serum ferritin, both who are lower, indicate the early stage of iron deficiency. Other serum ferritin, transferrin, saturation, erythrocytes, protoferrin, and serum transferrin receptors are other measures used to examine the prevalence of iron deficiency. Then diagnostic of iron deficiency anemia. We should follow the serum iron level less than 60 is okay. Then total iron binding capacity is less than 300, more than 300. Transferrin saturation is less than 15. Erythropoietin prosperity is more than 100. Serum ferritin is also there. Then in case of iodine deficiency, severe iodine deficiency, urinary iodine concentration we should look about the urinary iodine concentrations are there less than 20. Severe iodine deficiency, moderate iodine deficiency is 20 to 49. Mild iodine deficiency 50 to 99. Ideal iodine intake 100 to 200. More than adequate iodine intake may increase the risk of iodine induced hypothyroidism. Hypothyroidism is 201 to 299. Excessive iodine intake is more than 300. Then D deficiency, clinical biochemical test are riboflavin, nutritional deficient test is urinary riboflavin, erythrocytic glutathione redo test, EGR test, niacin test are there, folic acid, serum folic, RBC folates are there, vitamin B12, serum B12 is there, zinc, plasma zinc. We should follow the biochemical test. Then we should estimate whether the person is suffering from any other deficiencies. Then dietary assessment. Dietary assessments are family household diet survey, weighment method, consumption expenditure survey. Assessment of dietary intake of individuals are individually oral questionnaire method, 24-hour recall method, food records or diary are there. Diet history is also there in dietary assessment. What is dietary assessment? When the symptomatic inquiry into the food supplies and food consumption of individual and population group is made, we called is a diet survey. The food consumption of an individual and the population group is made for the first of all we will take whether the person is coming under vulnerable group. If the person is coming under vulnerable group such as children, lactating mother, pregnant, we should distribute them in a group, and then we should estimate what kind of nutrition the person will give, we should give, or we should recommend the patients for their good growth and repairment or growth and maintenance. So it is known as dietary assessment. Family survey, family diet survey is Wetman method. Wetman method of diet survey involve actual weighing of raw food on a given day, and investigator visit the household before the food is cooked, weigh, and the help of Russell balance and electron balance of the food stuff that will be cooked for the days. Wetman methods means we will take raw foods, then after discard from the waste materials from the cereals products, then again weighted the take the weight of the foodstuffs. Then after washing, after peeling, after removing such skin and seeds from the fruits and vegetables, then we will, then after cooking, after cook, we also take the weight of the cooked food. This is known as Wetman method. ମାନେ ଫାର୍ଷ୍ଟ ଆମେ ତାକୁ ସବୁ ତା ଦେହରୁ ମଇଳା ସଫା କଲା ପରେ ତା ୱେଟ୍ କେତେ ରହିଲା, ଧୋଇଲା ପରେ କେତେ ରହୁଛି, ତାର ପିଲ୍ ଅଫ୍ ପରେ and removing of seeds ପରେ କେତେ ରହିଲା, after cooking how much food stuffs are reduced, we should calculate in this in this Wetman method. Individual diet survey. Individual questionnaire methods are there. 24-hour recall methods are there. Food records. Individual questionnaire means 24-hour recall method is used to large nutritional survey to collect dietary intake data of individual. In this method, the individual is asked to recall in as much as details as possible. Respond what was eaten, how much food was eaten, how was the food prepared, when was it eaten, and other details related to food intake. It is the one type of questionnaire method. We should prepare 10 to 20 questions. We should ask the persons whatever food you eat in a day, how much, what are the frequencies are there, and how much foods you will take, and which kind of food you will take in a day, etc. etc. We will prepare one questionnaire for whole day or 24-hour recall survey. It is known as 24-hour individual oral questionnaire, 24-hour diet survey. Whether he or she should take good amount of nutrient. Uh, um, the motive of this individual oral questionnaire method is whether the person is taking right amount of nutrients or not. Then food record or diary. Food record or diary method provides food consumption data of individuals. Food record or diary provides food consumption data. What kind of food the person should take in a whole day or 24-hour. Consumptions of data of individuals is known as food record or diary. Food and drinks consumed for a period of time, usually ranging for 1 to 7 days. Portion size also there. Food models are there. Standard measuring instruments are there. How much quantity, what is the timing, what is the drinking, kinds of foods we should record in a particular diary is known as food record. Then diet history. Collect general information about the subject health habits. Information is collected from the individual about the number of meals eaten per day. A diet history means we should collect the number of meals eaten per the day, such as breakfast, lunch, dinner, snacks, etc. Then whether you are good appetite or not, food dislikes, likes are there, presence or absence of nausea and vomiting. If you are any food allergics are there, any food which foods you don't like, which liking foods are there. Then eating patterns are there. Then between the meals, including types of food eaten, serving size, frequencies, timing, etc. are there. These are known as diet history. What is food frequency method? Food frequency method consists of asking individual through an interview. Interview will ask the persons about their same as before. We should ask about the likes, dislikes, allergies, vomiting occurs while taking this food or not, etc. Then this is then used as index of diet pattern of population group. Then what kind of foods you are taking in day to day life as a staple food, etc. And what outside foods are you are taking, what home based foods are you are taking. These are qualitative diet survey, whether the person is taking quality content food or not. Then food list and frequency questionnaire checklist concept to compare food list and frequency response section. Then the strengths of food frequency questionnaire are there, and relatively inexpensive and quick to administer in large survey. Then food balance sheet. What is the food balance sheet? Food balance sheet is the method of indirectly estimating the amount of food consumed by a country population at a certain time. Food balance sheet mean it is a method of indirectly estimating, not directly, it is indirectly estimating the amount of food consumed by the country's population. In India population, how much estimating how much foods were consumed by the country's people at a certain time. It is known as balance sheet. And then it provides data on food availability or disappearance rather than actual consumption. Either the food availability is there or not. we are suggesting protein calorie to the malnourished patient or protein energy deficiency patient. We are advised that patients, but whether the food protein and energy foods are available in that area or not, we should balance the if availability is very low, then we should try to available these types of food to the malnourished persons. This is known as food balance it. Thank you. Next we will study tomorrow.